Hello everyone, I'm Dr. Carrasco, the Pain Doctor, and I've spent over 30 years treating patients with acute pain or sudden pain and with long-term pain. I've stated on many of my TV shows that living in pain is not normal, and I really believe that. My mission is to help you understand what is causing your pain. To do this, I will help you understand the signs and symptoms, the diagnosis, and the treatment of many different types of pain. Today I will discuss a very difficult source of low back and leg pain called sciatica. Coming up next, I'm going to talk about a very painful condition called sciatica. It causes pain in the back, buttocks, and all the way down the leg, but could cause long-term deficits. This pain topic is brought to you by the Dr. Carrasco Pain Cream. I'm Dr. Carrasco.
I'm Dr. Alex De Jesus.
Today we're going to talk about a very common condition that affects millions of people. It puts a lot of people out of work, Alex.
I have a patient came to see me in the office last week. A patient says, I'm tired of hurting in the middle of my buttock, and I can't walk, and I can't sleep, and I have to accommodate myself. What condition are we talking about?
We're talking about sciatica. I saw one this week. I saw a patient also that came in, couldn't sit, couldn't stand, couldn't do anything. He was in severe pain, had been in pain for about a week or two, and he wasn't sure what was going on. But these symptoms generally are severe pain, low back, buttocks, and all the way down the back of the leg, almost all the way down the foot, in some cases to the foot.
He was walking like they just say this like an old man. You know, he's only 19 years old.
You can't sit down, you can't sit up, you can't do anything. So I think you have a part of the disc, this is the disc that's kind of sticking out like that, pushing on that nerve, causing your pain. Well, let me tell you what's happening anatomically in the body. So this is the spine here. What happens is these nerves come out of little holes called neuroforamen or nerve openings, and they go all the way down toward the leg. But if they get pressure on this nerve, if this disc right here, this blue area, bulges out and touches that nerve, it causes a lot of irritation, a lot of pain, and a lot of discomfort. A really, really debilitating situation.
So is the sciatica going to happen on one side, both sides, or both sides at the same time? How's the symptoms?
Generally, depends how bad the disc is, but most of the time we see it down one side, again, in the buttocks and down the back of the leg. So well, what do we do the exam? What do we see on people's exam? Well, we see this. Let's walk over here. Most people who have sciatica, Alex, they can't sit down. I come into the room and they're standing up. They don't want to sit on the bed. They don't want to lay down. They're just standing up and kind of pacing. They don't know what they're going to do with this discomfort because they have so much pain. And the nerve, every time it gets pulled up and stretched, it causes more pain. All right? So let's lay you around right here, see what we got. All right. So what do we see in a situation with someone who has sciatica? The nerve from back here is being pinched. And because it's being pinched, anytime you stretch that nerve, it's going to cause more pain. So I take a patient that's laying flat. Many times they can't lay flat, as you know.
They can't lay flat. They're going to be ouching right now.
Exactly. But when I try to bring this up like this, it just causes severe pain. All the way down the back of the leg, almost to the foot. It's a really uncomfortable situation. You can do the other side and generally won't have any symptoms, but it's one-sided almost all the time. All right, sit up for a second there, Alex. Now, so many times what we do is we actually check the person's reflex, if they can sit. Again, at first, they're so uncomfortable, sometimes they can't even do that. But we're going to go right in here to the knee. We're going to check the reflex here. We're going to check the reflex here. And then we'll also check them down here at the bottom. And that'll tell me a good idea if the nerve has been irritated, as you know, and what nerve has been affected.
So the reflex is like checking that electrical circuit.
Exactly.
Is it complete? Is it going good? How's it doing?
The other thing we'll check for is numbness. If you have numbness, we check here in the skin. Anywhere different comparing one side to the other. Again, the nerve could be being pinched, causing this discomfort.
Is this patient going to get some x-rays and an MRI, some kind of evaluation?
The diagnosis is made clinically, but also an x-ray and an MRI will confirm what level is involved and what nerve is involved. Then simply, we generally, in most of those cases, do what we call an epidural injection, where we take a little bit of steroids, put it right there by the nerve, decrease the inflammation, decrease the pain, and hopefully get them back on track. This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
The Carrasco Pain Institute. Schedule your appointment today. Give us a call at 210-614-4825. For the latest news on pain conditions, symptoms, diagnosis, and treatment, follow us on Facebook, Instagram, Twitter, and YouTube. Or visit us online at Dr. Carrasco Show and CarrascoPainInstitute.com.